Hi, everyone. I'm Fanny, Marketing Manager here at Kids and Company. Thank you all so much for joining us for today's webinar. We would like to welcome Catherine Lau, Certified Art Therapist from the Giving Tree Center. The Giving Tree Center is a children's mental health clinic comprised of experienced team of mental health professionals, including child psychologists and psychotherapists, occupational therapists, speech language pathologists, and parent coaches. They help kids and families develop the awareness, skill, and capacity to heal, grow, learn, and thrive. Today, Catherine will talk about how children can engage in self-exploration and find healing through process art therapy. She will discuss how art therapy can benefit children and provide tips on how to talk about art to encourage creative thinking. Catherine will also talk about how art therapy can benefit children and provide tips on how to talk about art to connect with children. We're so thrilled to have Catherine join us today. If you have any questions throughout this session, please use the Q&A function at the bottom of your screen, and we will ensure that your questions will be addressed at the end of today's session. So Catherine, it's over to you.
Okay, so I'm going to talk about the benefits of art therapy for children. Hi, it's so nice to connect with everybody here. I am Catherine. I'm a psychotherapist, an art therapist, and behavior analyst at the Giving Tree Center. This is a mental health agency providing children's psychology and well-being services. We work with kids in the earliest stage of development to older adolescents, and I'm aware that there are both US and Canadian audiences joining us today. Welcome all. The center provides in-person and virtual services, so we can offer services to KidCo families in both countries. So when I take off my therapist hat and I'm not doing therapy, I also teach students at Fanshawe College, the School of Community Studies. And I spend the rest of my time playing with my two children and cleaning up after them. That takes a lot of my time. So today we're going to go through a number of items. What is art therapy? So the science and brain physiology behind art therapy. How can art therapy benefit children? Parent involvement with art therapy, and how to talk about art to encourage creative thinking in kids. So what is art therapy? Art therapy is the combination of creative expression and psychotherapy. The client uses colors, lines, shapes, and different materials, and sometimes imagery and metaphors and storytelling to express themselves and discover what they're feeling or thinking. The therapist and the client work together collaboratively as equals. Building a strong therapeutic relationship is really important within art therapy. There's a lot of research showing how clients with a strong, trusting relationship with the therapist have positive outcomes on the client treatment outcomes. So within art therapy, having a safe and supportive space is really important. It can also provide a safe structure in which the child can understand, process, and heal. A focus of art therapy is to use creativity and imagination to play with materials, explore, and understand the self. This may assist children in processing life events, find healing through the process of creation, imagination, and creative thinking also involve brain physiology and executive function, stimulating all parts of the brain. And the focus of art therapy is on the process versus the product. So we focus on the art and creative process versus what the art actually looks like at the end. And there is a misconception. I always get asked if I analyze the art. So art therapists don't analyze the art. We always let the child explain their creation and tell us what it means to them. So the purpose of art therapy is not to eliminate suffering and pain. Rather, art wants to give suffering a voice. It's like a container for the pain. To express this confusion and pain through art in itself is a transformation. The child can have an opportunity to externalize what they're feeling, get it out of their head and get it out of their heart and put it on paper. They can look at their pain, see what color it is, shape, texture. Maybe the pain is a creature or person, like maybe it's hairy, maybe it's hungry. They can try to understand it and understand themselves. Maybe begin to let go. Perhaps they can give the pain what it needs. Maybe it needs a safe space just to be. Maybe it needs a little love or a friend made out of purple clay and fluffy feathers. It's absolutely heartwarming to see and hear the responses of kids, seeing what they create to give their big emotions what it needs. So healing really takes place in the use of imagination and also in the safe space between the therapist and the client. So how long has art therapy been around? Art therapy is about 80 years young. Psychology as a field has been around since the 1890s, whereas the use of arts to heal and understand oneself and the world around us is really an ancient healing practice that spans across cultures and time. The art therapist is a mental health clinician who has education in both fine arts and counseling psychology. We study a master's level education, including supervised clinical practice, which ensures the quality of service and safety of the child in art therapy. In Canada, art therapy itself is not a regulated health profession, so anyone can call themselves an art therapist. But in Ontario, art therapists can register under the College of Registered Psychotherapists as a regulated health professional. So you might see some art therapists with the letters RP, Registered Psychotherapist. So the science behind art therapy. When someone engages in the creative process, this can increase blood flow to the prefrontal cortex and releases dopamine. And the dopamine is the feel-good hormone. Dopamine plays a role in pleasure, motivation, and learning. When dopamine is released, it can have a positive effect on both our physical body and our minds. Now, all clients have different art therapy goals. Oftentimes, parents will come to me with specific goals, and the main goal of art therapy is to assist change, whatever that might be. Another goal is to build a supportive therapeutic relationship between myself and the child. We try to communicate through the materials, through art. And other children, they prefer communicating more through words, which is all right too. Art therapy doesn't always have to be about art making. There can be sessions where the focus is more on talking or play, and that's the communication form, whatever works best for the child. And as a therapist, my goal is to provide an empathetic and understanding safe space to provide non-judgmental positive regard and meet the child where they're at. I'll always ask the goal of the child, and most often they'll tell me their goal is to have fun. So I'll make sure I prioritize this as well. So let's talk about art therapy and how it can benefit children with specific goals. Coping with big emotions and increasing emotional regulation is a common goal in art therapy. Practicing mindfulness and grounding can also be a goal, and figuring out what might work for the child to help the child ground. So grounding can help a child stay in the present moment instead of their mind going into a place of stress or fight or flight mode and respond with undesired behaviors when they're feeling upset. So through art therapy, we might notice their five senses, focus on their sight, their touch, their hearing, their smell, their taste, and through the art and creation can help the child focus on these senses and strengthen their mindfulness. And self-regulation is like a skill, like learning a skill like math or writing. Practice makes perfect. It's really important that children practice these coping skills, even when they're feeling calm, to strengthen this coping muscle. If our child could demonstrate the skill when they're calm, they're more likely to use the skill when they're feeling upset. Co-regulation is also a focus of art therapy between the therapist and the client. So this co-regulation is important for younger children who don't have the self-regulation developed skills yet. This is what the therapist encourages self-regulation through coaching, modeling, and feedback. So I'll show them deep breathing strategies and grounding strategies. And this could be helpful to do within the structure of the safe and supportive therapy space. And lastly, the focus is on the process, not the product of the art. So this could be really helpful for clients who are perfectionists. They want things to be a certain way. For children like this, I might think of art directives that are high in sensitivity and low in skill. One example is playing scribble tag with them. We'll try to tag each other with our oil pastels and make a giant scribble together. Then we'll look at our creation and try to find things in it, see what they see within it. Sometimes people and animals and stories emerge from the scribbles. And this really helps me understand what the child is thinking, feeling, and what's going on in their life. And developing self-understanding can be a goal of art therapy. And this can be different for different kids. For some kids, it's understanding their big emotions. It can be really confusing and overwhelming for kids to experience big emotions like anger, guilt, jealousy, and figuring out what do I do with myself in these instances when I'm feeling these really intense states. So art therapy can help develop self-awareness of how they respond in these moments. It can help explore self-identity and their parts of the self, exploring the silly parts, the angry parts, the sad parts, the compassionate parts, the helpful parts, all the parts. Art therapy can help a client increase self-awareness, develop self-understanding, or explore self-identity. And anxiety is something that is very common when I see children who come to art therapy. So art therapy can help children externalize the stress, get it out of their heads onto the paper, and engage in healthy coping strategies. Externalizing of the anxiety can look like drawing what it looks like on the paper. Maybe the anxiety looks like a giant tiger roaring. It's really angry, and the tiger needs a loving environment. And I'll ask the child to create this safe environment for the tiger. Maybe they create some nature, some trees, water, ice. I'd ask the child to play with this character and also practice mindfulness and grounding oneself when they meet this character. Another part of art therapy is psychoeducation. So teaching the child and understanding their physiological body responses when they're feeling anxiety. So what does your body feel like when you're feeling anxious? Do you feel a racing heart? Do you start to sweat? Do you feel really tense hands? What do your feel like? When people say my feet need to kick. And the breath, do they notice their breathing? It often goes faster. So noticing and being aware of these body cues can help with grounding as well. And the last thing that is really important in art therapy is normalizing of emotions. Some kids I work with feel a lot of guilt and shame for their behavior after, let's say, a tantrum or a breakdown, and they don't even want to talk about it, which doesn't help. So we can try to focus more on the repair after a rupture within art therapy. Receiving psychosocial support from an art therapist can help children who feel lonely or socially isolated feel understood and connected. And one practice that can be helpful with kids who face anxiety and depression is gratitude practice. Sometimes we fixate on what we don't have, what is bad, or we're stuck in a storm. We miss the things in our life that we do have. So focusing on what we do have and what we can cherish, and what might help us foster some joy, can help us focus on what we're grateful for, and this can help with anxiety and depressive feelings. Art therapy can be helpful for a client who has difficulty expressing themselves through words. The externalization of big feelings, so getting the anxiety out of the head onto the paper, can be really therapeutic. Using symbols, colors, and shapes and lines can help. Some teenagers find it really helpful using metaphors and symbols rather than describing exactly what happened to them in their life. Art therapy can help strengthen positive coping skills, promote a sense of achievement, improve self-esteem, understand the developing self. parts of the self. So the funny part, angry part, calm part, creative part, and not just see themselves as an angry or a bad person because they had a tantrum. And seeing their strengths. This is something I really try to focus on, highlighting their strengths, highlight their coping skills, highlight their creativity and imagination, their risk-taking skills within art therapy, trying new things, practicing, and practicing their coping skills and grounding. And making sure I'm reinforcing and praising the child for their efforts and their gains and their changes. For children who experience trauma early in life, when the self has not yet been clearly defined, it can be really helpful to experience structure, boundaries, clarity, and definition. To combat a world of chaos and disorganization, the art therapist can provide a holding space that is gentle and also firm, connecting the worlds of image and outer reality. The therapist will offer a safe space where the pain from the trauma can heal. Art therapy may aid in processing trauma from event from their past. It can be the therapeutic relationship between the child and the therapist that helps heal. And also practicing of grounding and co-regulation between the child and the therapist can help heal from a trauma. And a frequently asked question that I get is about trauma work is the processing of it. Like, do I bring it up? Do I ask the child about the trauma? So sometimes and sometimes not. It really depends on the client and their needs. Some children find it helpful to go through the trauma. They'll bring it up, they'll describe it. Others, not so much, and it comes up in different ways. Sometimes we don't need to talk about the specifics about the trauma event to have healing through art therapy. The focus can be more on grounding and mindfulness and being present in the moment. Let's talk about 3 case studies. So the first one is Tanya. She's 3 years old. She has separation anxiety and a lot of difficulty with transitions. She's only 3, so it's really normal for her to be attached to mom and not want to leave mom. Mom wants to set Tanya up for success when she goes to school next year and see if there's anything she can do to help make transitions a little easier, less painful for both of them. So they start art therapy. Tanya loves getting messy. She loves the sensory aspect of art and play, and she comes to every session with mom, and they participate together. She's got lots of energy, and the difficulty with their transition is explored through art therapy. Mom and Tanya play through the art materials and explore how they're both feeling. Tanya was really resistant talking about difficult emotions, but this was a safe space for her to start talking about feelings. She and mom worked together to create transition objects, a separation ritual, and artwork together around their family. And through the structure of art therapy and practicing mindfulness and grounding, noticing her breath, noticing her body, Tanya started to understand boundaries, clarity, and decrease the separation anxiety. Our next case is Billy. Billy is a 6-year-old boy who's curious and loves art. He has really big emotions. He's brought to art therapy because he has difficulty with emotional regulation, tantrums, and sometimes hitting out when he's angry. Parents share that he seems guilty afterwards, but he refused to talk about his emotions or behavior. So he comes to art therapy. He didn't want to come with his parents, just by himself. He wanted a safe space, just him. And he made some art about it. His emotions were confusing, like a thunderstorm with sunshine and clouds that happened all at once. And we played with the different parts of the brain to get an understanding of the fight or flight response. So we have Amy, the amygdala, the emotional part of our brain that protects us, but sometimes not in the right way. And the hippocampus, the memory part, the part that can remember to ask for help and solve problems. And text the tiger or the prefrontal cortex of her brain, the problem solver. And playing with these little characters, always fun. Figuring out how they can work as a team in his brain so he can engage in actions that he can be proud of. He focused on emotional regulation, practicing coping skills, and parents gave him a lot of praise when he practiced these coping skills, engaged in these alternative behaviors instead of hitting or tantrums. And he made lots of gains. Our last case is Sue. She is 11 years old and struggling with transition into adolescence. She has really big emotions, and when she feels mad, she's really, really mad. Art therapy was a safe space for her to vent, share her frustrations, share how she feels, that she's being judged by her family, friends, the world. She could express all the pressure she feels from society that's placed on her. And she created a wish doll, putting a little intention into her. And through creating this doll and art, she gained confidence in herself, in her actions. So these are some frequently asked questions. Are there children for whom art therapy is better suited than other modalities, such as play therapy? So I find for kids who have trouble with focus or attention, the sensory and kinesthetic aspects of art therapy and creating something with our hands can be helpful. For children with attention difficulties, cognitive-based therapies might be more difficult for them to withstand this attention. So they might have more difficulty engaging in cognitive type therapies. And I also find for older kids who prefer using metaphors and symbols to express themselves, art therapy might be the right fit. And for kids who just enjoy art, it's always really helpful. Sometimes they gravitate towards art therapy. And am I directive or do the children take the lead? So similar to play therapy, art therapy can be directive and non-directive. And art therapists typically work on a continuum based on what the child needs in the moment and how they present during session. So sometimes I work with clients who really like hearing a directive. I tell them exactly what should they draw. And other clients, I give them a directive. What should they create? And they don't really answer it, but in not answering it, they're telling me what they need and how they're feeling. So there's really no incorrect response in art therapy. Any response shows me what lies beneath the child and helps me to understand them. And how do we talk about art to encourage creative thinking in children? So engaging in curious questions, being curious. Just asking about the art. Oh, can you tell me about that? Versus what is that? Asking open-ended questions can be really helpful. And simply describing what we're seeing. So describing the colors, the lines, and the shapes, rather than the beauty or the aesthetics of the art piece can be really helpful. And encouraging creativity and expression versus creating pretty or a perfect image. So the process versus the product. And encouraging a child to keep trying to create, keep using their imagination. And art is like a skill. The one more practices the skill of art, the more skilled they become at expressing themselves through art. And fostering efforts in creativity and curiosity and exploration, play and imagination is really important. We want to encourage art as a skill that can be learned, to keep trying, even if the creation didn't turn out exactly as we had imagined. Keep trying to encourage them to try again and build resilience. And how do we talk about art to encourage creative thinking? Is art something that can be adapted or useful for parents and teachers who aren't trained in as therapists but want to connect with children through art? Yes, of course. So there's lots of different ways we can engage with our children through art. My favorite ways are getting messy, enjoying the sensory aspects, finger painting, squirt painting, throwing paint. And of course, I try to do all of these things outdoors in a park on a balcony. So the cleanup is not as difficult and making sure we're wearing clothes that we don't care too much about. And chalk art, that's always a fun one, using the world as the canvas. Also, very little cleanup. So thank you so much. Now is the time for question and answer.
Thank you so much, Catherine. That was so informative. I think art therapy is such a unique topic that parents are definitely curious about. So learning more about it today, I'm sure, is very helpful for all of our audiences. I just wanted to remind everyone here that if you have any questions, please use the Q&A function below. So Catherine, we do have some questions from our families here. So I will start with the first one. Are there specific age ranges or developmental stages when art therapy is most effective for younger children?
Yeah, so I work with children from 0 to adolescents. Yeah, so in terms of most effective, for children who are maybe 7 or younger, it's most effective, I find, when it's more of a family art therapy session. The kids' emotional regulation hasn't quite developed yet, so it's really, really important for the families and parents to be involved during art therapy so that they're also learning and figuring out what works for their child so that they can bring it home and transfer these skills and really make more gains. And then for 7, 8 plus, individual art therapy or family art therapy can be helpful depending on the child's needs.
Are there any negatives or concerns about starting art therapy too early?
Yeah, so I wouldn't say that there are any risks of participating in art therapy. The focus is really child-centered and strengths-based. So exploring their emotions, their senses, yeah, positive things.
How do I know if my child might benefit from art therapy and what signs should I look for?
Yeah, so I think about what is the goal? So would they benefit from it? The first thing I'd ask is, would they be okay coming to an art therapy session? Some kids really, really don't like art. So it's helpful when the child likes the creative process, but of course, that's not a mandatory requirement. So if they like art, that's a plus. And connecting with a therapist, therapy is a really individualized thing. So it's important that the child connects with the therapist and they're able to build that strong relationship. So, yeah, that's something I would look at as well, making sure that there's a trust in the relationship with the therapist, that it's a good fit. And I guess checking in with the therapist on the goals and seeing if the therapist feels like they would be a good fit for the child as well.
Thank you. Our next question is, how would you navigate art therapy for a young child, so around 3 to 4 years old, in a high conflict co-parent situation? For example, so you mentioned that doing art therapy as a family type event for young children, but how would you navigate that if the parents aren't together?
Yeah, so that's really tricky. So, in terms of starting art therapy, I'd recommend starting it when the family has figured out a sort of a mutual agreement. Let's say if one parent were to go with the child to therapy, that the other parent is on board and they're consenting to this. Once there's a mutual understanding with this family situation, I would recommend starting art therapy. Yeah, because it can be difficult for the child as well and difficult to figure out therapy goals when there's a high conflict family situation. So, really focusing on the child and what they need is helpful. So, making sure all the other conflict situation is moved past and we can focus on just the child and the family is both on board with this. So, working really closely with the therapist is helpful to make all those arrangements.
How would you encourage discussions to start art therapy for for families that are doing co-parenting?
So I guess if I were a parent and I wanted the co-parent, I thought my child could benefit from art therapy, from a parent perspective, I'm thinking I would approach the co-parent and say, hey, I think this would benefit our child. What do you think? I think they can make these gains. I think maybe they could work on emotional regulation, and they really need someone to talk to. This family conflict has been a big stress for them. So I think we should try getting them into art therapy. What do you think? So I'd start it off like that. Yeah, see if the other parent is on board with it first. Yeah, because that's important too, that both parents are on the same page. And it's, I guess, known to both parents and they're both supportive of this. Because the child can feel any stress, right? So if one parent wants them in therapy, another parent doesn't, that in itself might not set them up for success in therapy.
Thank you. So our next question is, how can parents support and encourage their child's art therapy journey outside of therapy sessions?
Yes, very nice question. So outside of art therapy, depending on what we're working on, so let's say they're working on coping skills, grounding skills. If the parent notices they're engaging in art or grounding or self-regulation or doing any of the things that they've talked about in session, lots of praise and encouragement, that's always really helpful. And yeah, encouraging the child to do art outside of art therapy to express how they're feeling, or just express themselves, being creative. That is helpful as well. And again, not really focusing on the product, but the creative energy, the act of creating and using imagination, those skills. So reinforcing them for engaging in that.
And what role can parents play in the art therapy process, and how can they communicate effectively with their child's therapist?
Yeah, so what role? So we mentioned for the little ones, 7 and under, oftentimes the family is involved, the parents are attending with the child. So that involvement can be really, really helpful so that any gains or things that they learned during therapy, the parent can bring that home with them and continue to practice and make more gains. Yeah, and for the ones that are a bit older, maybe the children are going to therapy individually and the parent doesn't know as much as that's going on. I'll always ask at the end of the session if the child is okay with me sharing what we talked about. Usually they'll say yes, and we can focus on any of the skills that we practiced and how they could practice it at home. So encouraging the child to engage in, let's say, mindfulness practice or art process, or whatever that is helpful for the child at home can be helpful.
So, can you explain the potential long-term benefits of art therapy for children as they grow and develop?
Absolutely. So every child is different, and some kids, it can be helpful for them to have this safe therapeutic space to help with the development process. So there's a lot of benefits for mindfulness, grounding. We looked at the science of art therapy, how it can increase the blood flow to the brain and increase the dopamine in our bodies. Yeah, which is affected in our thinking and our memory and our planning. Yeah, lots of brain benefits and mental health benefits as well. So it can help uh, increase our feelings of calm, especially if we're practicing these skills throughout.
So, what is the typical duration and frequency of art therapy sessions for younger children?
Yeah, so I usually see kids for about an hour, even the younger kids, and the duration that's recommended is about once a week. Some kids prefer or need maybe once every 2 weeks or 3 weeks. Yeah, that's usually the frequency duration. And of course, I'm flexible. If some kids they have a shorter attention span, so 30 minutes or 45 minutes, that might be better for their learning.
Can you provide information on whether, and you may or may not know this information, Catherine, but on whether or not insurance typically covers this type of therapy for children?
Yeah. So in Ontario, Depending on the practitioner's credentials. So for myself, I'm a registered psychotherapist. So most insurances do cover psychotherapy. So the insurance could cover art therapy under the psychotherapy umbrella. In other provinces or in the States, it might be different. So I would recommend that you ask your insurance company what is covered. And when you find a therapist who you think would be a good fit for the child, ask for their credentials and see if those two match. But yes, in Ontario, typically insurance covers psychotherapy. So any registered psychotherapist would be covered by insurance.
Thank you. And then we have this fantastic question from a parent that just asked, can you share more examples of other open-ended questions that parents can ask their kids when the kids are showing their art?
Yeah. So some open-ended questions we talked about are, tell me about that. So just noticing anything about it. So I'll give an example. There is some art. It's sort of blurred now. It's okay if it's blurred. So I notice the red. Oh, can you tell me about the red there? Or, oh, it looks like it's splattered. What do you think happened there? And see if maybe this child will come up with a story. Another question could be, where would you be if you were in this image? Where would you be? Or when you look at this picture, what would you call it? What would you title it? Yeah, what else? The movement, asking about the movement or the quality of it. Like, is there a direction that this is going? Tell me about the direction of the movement. Or the sound. What sound would this piece of art make? That would be another one. Yeah, there's so many questions. Those are just a few.
And then this is going to be our last question. So just kind of reiterating what's on your current slide right now. So how can parents contact you or the Giving Tree Center if they are from Canada or the United States?
Yes, absolutely. So the contact information is here, thegivingtreecenter.ca, or info@thegivingtreecenter is our email. You can contact us if you have any questions, concerns, if you're just curious, you're wondering if a art therapy or any sort of therapy might be helpful for your child. Always welcome to call and talk to us.
Thank you so much, Catherine. That was all the questions that we had for you today. Thank you so much for this wonderful Kickle Talk with everyone here. And, we really appreciate you sharing your knowledge today and what the Giving Tree Center has to offer us. I'd like to remind all participants that there will be a recording following today's session and other materials, as well as a survey that will be popping up shortly. Thank you all so much for taking the time to be here with us today for today's Kickle Talk with Catherine. We hoped you learned a lot about art therapy and how it's beneficial for you, your child, and your families. Thanks again and have a lovely day. Bye, Catherine.